Hello, it's Michael Finkley. Thank you so much for joining in on the Michael Finkley Show this week. I want to say thank you. Thank you, thank you, thank you. Thank you so much for the viewers that have watched last week's show. You have made us a huge hit. I want to thank you to the supporters, the viewers, everyone that has given some awesome feedback to us. We're taking all of that into consideration and we're making this show better just for you. The news that you need to hear and you want to hear as well. So thank you, thank you, thank you. Don't forget to subscribe to the Michael Finkley channel here on YouTube to view the Michael Finkley Show every Monday on YouTube. So again, thank you, thank you, thank you. God bless. I want to give a major shout out to Allen University. I'm wearing my Allen University shirt. It is my dear alma mater. I enrolled there in 2007 and graduated from Allen University in 2011 with a Bachelor's of Arts in English Literature, and it has changed my life dramatically, professionally and educationally, to go on to other levels of higher ed. And so this is to you, Allen University. Thank you for making me the person I am today. So thank you, thank you, thank you, Allen University. Love you to pieces, and I don't mind giving back to my dear alma mater. So, on to today's story. We are bringing you awesome coverage of health professionals on today's show, where they stand, what they're experiencing. But before we get into the interviews, I just want to give some data. The coronavirus is still around. It's still affecting people, their lives in so many ways. Many people are dying. Many people are affected by, again, with their jobs and other aspects of their lives. So let me just give you some stats. I received this information offline. This is information as of April 18th. I'm sure that the numbers will definitely go up by the time you view this episode of the Michael Finkley Show. But let me just give you some stats as of today, April the 18th. Confirmed cases of the coronavirus, 716,995. Recovered. Now, we always hear in the news, in the media, how many deaths there are, but we have to realize that a lot of people are recovering from this as well, and they are telling their tales. So recovered from the coronavirus, 59,749. Deaths total of the coronavirus, you're looking at 33,082. Now, again, this is the 18th of April, so I'm sure by the time this is aired, the numbers will go up dramatically. And also, New York is leading the way in high numbers. Confirmed cases in New York as of now, 222,284. Recovered from the coronavirus, 17,089. And then deaths from the coronavirus in New York, 14,636. Again, it is still around and it's still affecting people. As of April 15th, the president has announced reopening various states. Again, just reopening the country, as in going back to work, as in going back to school. Take a look at what he had to say.
Tomorrow I'll also be leading a call with elected officials who will consult with my administration as we work to restore our economy to full speed. And we really think with all of the stimulus and all of the pent-up demand, we're going to have an economy that really comes back quickly, and would like to see it more than match what we had before. What we had before was a miracle, and we think this is going to be even more than a miracle. We're going to do it because we have the greatest people in the world. We'll also be speaking to America's governors tomorrow, and then we'll be announcing exactly what's happening. You already know we'll be opening up states, some states much sooner than others. And we think some of the states can actually open up before the deadline of May 1st. And I think that that will be a very exciting time indeed. Governors are looking forward. They're chomping at the bit to get going.
This is my face right now. Why would you, as the leader of the free world, reopen the country before even the deadline, whatever that looks like, whatever that is, of May 1st, and continue to unleash this virus. People are still being affected by it. Even though they may not be dying from it, they have it. It's affecting them. They have to quarantine themselves. They have to keep themselves away from people. They have to, it's just, why? Why? That just really, it makes no sense to me. You're giving the governors the power to, do what may and reopening their states or what have you. But at the end of the day, they have to listen to you. So why would you want to, even right now, think about? I know that a lot of people I've talked to or text or what have you, they're like, I'm tired, I'm bored. But y'all, stay inside. Stay inside, stay inside, stay inside, so this thing would not affect any more people. I've seen too many of persons in the profession of healthcare pleading on Facebook, on Instagram, on television. Please stay home. Please stay home. Wash your hands. Try not to be around people. Don't touch your face. Just stay home. And what really gets me, this is what really gets me, because I do have to go out at times. I have to, pick up my niece or, go to the store for my parents or what have you. So this is what really gets me. I'll see, like, especially since these checks that our president gave us are in full effect now. And so I'm seeing a lot of people just congregated for no reason. They're at the gas station and they're not just doing their business. They're just standing there talking. They're just standing there just having a good old time. Or, stay home, people. Stay home, stay home, stay home. I just don't get this order. I hope that by the time this video comes out or, down the line, that the president just has a faint of heart and just say, come on, let's just keep this order for another 30 days or another 15 days to see where it goes. Again, people are being affected. Why would you open up a school and have students, thousands upon thousands of students, come back and you're exposing them? You're allowing people to go back to work. You're exposing them. So therefore, it will not get better. It will get worse. That's just my thinking. Comment below. What do you think? Do you think that the country should reopen May 1? What are your thoughts? How are you feeling about this? Because it just grinds my gears and I'm just like, people are not taking this seriously. Stay home and wash your hands and wash your rump. Also, that's just me talking. But stay home. Stay home. If you stay home, you won't get it. I promise you. Let's just think about this a little bit more clearly, okay? Because at the end of the day, it is affecting a lot of people. Whew. It's good to vent. More to come. We'll be right back. On the next Michael Finkley, fitness coach and physique competitor EJ Jenkins is here to give us advice on how to stay physically fit during the coronavirus. So EJ, I have my gym clothes on, as you can see, okay, and I listen to whatever you have to say because this weight has to come off, okay? So let's do it. Come on, let's go, bro. And financial advisor Sean Glover is here to give us tips on how to capitalize on your stimulus packet. So I'm going to listen to Sean. That's why he's here on my show, to save this money that I have. So I need you to listen too, okay? Join us on the next Michael Finkley. Yeah. Welcome back. So again, we're talking about the coronavirus, as is everyone. But the persons that are seeing the most, that are helping them through this crisis, are our healthcare professionals. They have risked their lives on this particular outbreak, and we owe a lot to them. We salute you. Our hats off here at the Finkley Show go off to you. Again, you are at the front line of this outbreak, taking care of those that are affected by this medically. And so first, we're going to have Miss Toya Williams. She's going to talk with us about her experiences through the coronavirus. She's a nurse in California, and I tell you, she has seen a lot. So, Toya, take it over.
Hi everyone, my name is Toya. I am a registered nurse here in the City of Angels, and I have the pleasure on speaking on healthcare professionals during coronavirus. I want to start by thanking Michael Finkley. Thank you for providing an atmosphere and a platform for people to get vital, insightful, educational information on what's happening in the community. If you haven't already, I suggest you really subscribe to his YouTube channel. There are a lot of great topics to come. Now, coronavirus. It is getting real. It is real. Here in Los Angeles, California, we are definitely seeing the cases coming in. We're definitely getting the patients. I have been working in the ICU for the entirety of my 6 years as a nurse, and I have never seen anything like this. And I think my colleagues can all say the same thing. This is real. I work in Long Beach, California, where we have the highest amount of coronavirus cases in LA County. And what I want to make sure that you know is that coronavirus definitely has an impact on patients that already have comorbidities such as COPD and asthma, but I'm also seeing patients that don't have comorbidities. I'm also seeing patients that are young that are really taking hard hits from this coronavirus. We, as medical staff, doctors and nurses both, are doing everything we can to take care of these patients with the information and guidance that we do know. We are adequately protecting ourselves. There is a hot commodity out there for N95 masks, goggles, making sure that we're staying safe. And I'm so fortunate to have a staff of leadership at my hospital that is really putting a priority on making sure that we're staying safe. But how can you stay safe? Please, if you go outside, the CDC has now changed those guidelines. So if you are going outside, wear a mask. People are symptomatic and there's others that are asymptomatic. And you want to make sure that you're not grabbing coronavirus or you're not also giving coronavirus. So please keep each other safe. If you're going to do those essential runs like the grocery store and the pharmacy and any other things that you may need to do, please make sure that you're remaining safe and that you're taking care of yourself and your families. I have seen a lot of questions about whether we will ever get out of this. We'll get out of this. And the timeline ranges from person to person. Of course, from what it looks like, New York may have the longest range with this because of how many cases they're constantly seeing. But as we get better and as we start seeing less cases and as we level out, we will see a lifting of the stay-at-home ordinances as states and counties get better and improve. And that all has a lot to do with us and how we stay at home. During this outbreak, a lot of people are harping on the essential personnel. If you're not essential, stay home. But I also want to make sure that we're thinking about those non-essential personnel where we weren't created to stay in the house, right? Like we weren't created to be solitary and to be by ourselves. And some of us harp on that. All of our extroverts, they harp on that person-to-person contact. And so making sure that we're not being insensitive to those who need that mental stimulation, who need that extra interaction with others. And I see that Zoom is really stepping up. FaceTime has been the saving grace for a lot of people so that we can still maintain that communication with our family members, our loved ones, but do it differently. So I encourage you to still find creative ways to stay safe, but to also make sure that you are keeping up with your interactions with your loved ones. It's so important. Again, thank you so much for having me on the Finkley Show. I really, really have enjoyed taking care of my coronavirus patients, and I hope that we continue to lessen the curve, and eventually I'll see you outside when it opens again. See ya.
Thanks, Toya, for giving us your advice and sharing your experience with us as well as you see on a daily basis on the front line during this pandemic. I do hope that the American people are listening and taking heed to your words. At the end of the day, it's about all of us, self included. We don't want to infect ourselves, and we don't want to infect others. So, again, thank you, Toya, for your words, and we will be right back. The Finkley Experience is an education and consulting firm that specializes in first-generation education. We assist parents and their students with the college process. We train school administrators, and we also partner with colleges and universities to assist with their first-generation population. To learn more about our consulting firm and to purchase our book and workbook, please visit our website at thefinkleyexperience.com. Welcome back. So the conversation continues with our healthcare professionals, those that are on the front line caring for those who have been affected by the coronavirus. We have Miss Myosha Robinson, another nurse here in the state of South Carolina, and she gives her experiences and advice to keep us safe. Take it away, Myosha.
Hi, my name is Myosha Robinson, and I am a registered nurse. I received my bachelor's of nursing from Francis Marion back in December 2017. I have been in the nursing field for going on 3 years. My experience includes postpartum nurse for 9-10 months, critical care nurse for 1.5 years, and LPN instructor for 7 months. As a postpartum nurse, my goal was to educate new parents on how to take care of their baby, as well as some tips and tricks that they can use at home. As a critical care nurse, my goal was to help patients who are in very critical state, help them get back or achieve their basic level of functioning. As an LPN instructor, my goal is to educate college students and help them transition into the healthcare field themselves. Not only do I educate students, but I am also a college student myself. I am currently in the grad program at Francis Marion, seeking a master's in nursing, specializing in family nurse practitioner with a projected date of December 2020. During this time where we are dealing with the pandemic of the COVID-19, it's very imperative that we are doing our part in order to stay safe and to reduce the amount of cases that we see on a daily. There has currently been an influx of cases for the coronavirus, so it's definitely important that we help flatten the curve. Some tips and tricks that you can use at home. Number 1, hand washing. Hand washing is very effective when it comes to reducing the spread of many viruses and bacteria. 20 seconds is the recommended time to properly wash your hands. 2, you can also use a mask. Surgical masks are normally the ones that you see in the hospital, and a N95 respirator mask. It's a little more expensive, however, you definitely is very effective when it comes to protecting yourself and others from the spread of the COVID-19. Cloth mask, although very creative, is very important that you have a filter in place for those masks. You can also double layer in order to reduce that spread, as well as placing the filter as stated before. Wiping your counters with Clorox wipes, Lysol, things of the sort in order to reduce that spread of the virus and the bacteria. Definitely try not to touch your face or your eyes or inside your mouth if you have been touching public areas with your hands. You definitely want to make sure that you try to not do that so that way you can reduce that spread. When you are out and about grabbing your essentials, it's definitely important that you are practicing social distancing. The recommended amount of space that the CDC has suggested was 6 feet. And with that amount of space, that reduces the spread of that virus should someone cough or sneeze. And it doesn't project to you because you are practicing that distancing. In the end, it's very important that we are, like you said, doing our part, staying safe, being alert, and being aware. And in the end, we can definitely help flatten that curve. Thank you.
Thank you so much, Myosha, for your words and also tips to keep us safe. it is imperative that we listen to them and stop spreading this virus in order for things to get better for us. Thank you so much, and I wish both of you well as you continue to care for those who have been affected by the coronavirus. More to come. We'll be right back. On the next, Michael Finkley, fitness coach and physique competitor EJ Jenkins is here to give us advice on how to stay physically fit during the coronavirus. So EJ, I have my gym clothes on, as you can see, okay, and I listen to whatever you have to say because this weight has to come off, okay? So let's do it. Come on. Let's go, bro. And financial advisor Sean Glover is here to give us tips on how to capitalize on your stimulus packet. So I'm going to listen to Sean. That's why he's here on my show, to save this money that I have. So I need you to listen too, okay? Join us on the next Michael Finkley. Yeah. Welcome back, and thank you so much for watching. I do hope that you got something from this show when dealing with the coronavirus outbreak. I'm telling you, please stay safe, keep yourself safe, keep your family safe, and please enjoy one another during this time as well. It doesn't have to be a disaster for you, but we can make the best of this overall. Thank you to my guest, Miss Toya Williams, and also Myosha Robinson, for sharing their experiences and also tips for us to keep us safe during this pandemic. On the next Michael Finkley, we will have guest EJ Jenkins as he gives us advice on staying physically fit during this time of corona, and also financial advisor Sean Glover will give us tips on how to truly capitalize on those stimulus packets. Again, thank you for watching. Subscribe to our channel, The Finkley Experience, and watch The Michael Finkley Show every Monday on YouTube. Until next time, see you then, and have a good one.